with the government saying we can't produce vaccines right now, what do you have to say to Indigenous communities that are, this is another level of concern that we're putting on people right now in vulnerable positions? It seems like bad news when we've heard good.
Well, I think what Canadians want to see is every single Canadian have the opportunity to get vaccinated in perhaps the shortest period of time that it's taken to produce a vaccine and deploy it. It is an immense logistical challenge to deploy it, not only to rural and northern communities, but also in urban settings where you see vulnerability of Indigenous peoples, and indeed what's going on in Winnipeg with respect to hospitalization, Indigenous peoples being a disproportionate amount of that hospitalization, is a testament to the fact that we have to continue and have our options with respect to Canada, honouring our obligations with respect to First Nations, and that has to reflect the vulnerabilities that they face. Despite the fact that we're in a second wave that is immensely alarming, Indigenous communities on the first wave have fared well, but those underlying disparities exist, and all you have to do is look to the south of us to see the numbers hitting multiple times Indigenous communities than they are even those numbers that we're seeing in the U.S. So when it comes to the deployment of the vaccine, and the Prime Minister has said it, and we'll keep saying it again, First Nations have to be properly served by a first-class medical system that has underserved them historically, and that's what we're working on as we deploy the logistics of ensuring that all Indigenous peoples are treated with the first-class care that they're entitled to. This is a plan that's ongoing, and I don't think any of us will rest until every single Canadian Indigenous peoples have the opportunity to get vaccinated in the shortest amount of time possible. Thank you.
Be involved with the rollout of the vaccine?
No, the military's been involved from the beginning to making sure that we provide the appropriate support. And we've been part of the planning all the way through to making sure that this is a whole of effort to making sure that Canadians stay safe. So we have already a lot of work that's already been done. And as we start analyzing what needs to be done as more vaccines get approved, you'll see greater involvement. But I want to stress, this is a whole of government effort, working with the provinces as well to come together, and appropriate plan will be analyzed, and then it'll be presented and making sure that Canadians are safe.
Is the military going to be ready on day one of the vaccine approval to help get it to Canadians?
I want to stress this, we have been working with PHAC, PSPC from day one of the pandemic, right? And so when it comes to the work of the vaccines, the military will provide all the necessary support required. But I want to stress again, this is about working together. So the military can't do this alone. This is about working with all the government departments. It's going to be about working with the provinces and look at the systems that we already have in place because of our healthcare system. We're able to deliver it. So one thing I can assure you is that how collaboratively everybody has been working early on so that we're getting ready for the actual vaccine rollout. Okay?
Thanks, man.
Thank you so much.